When I first came on the trip, I just was completely taken with the people and the beauty of the place.
I've come every time since I started.
And it's a really spiritual and emotional and amazing thing to be able to bring a little bit of happiness to somebody else.
If you guys weren't here, what would they do for medicine?
Nothing. Most of the people that live here, they cannot afford to go to Santiago or Puerto Plata, because I know, they tell me too, how expensive are those doctors in the city, how expensive is the medicines,
It's a country and it's the people that really needs.
I wish everybody could come down here and see what we see every day and really understand the differences between life in the States, healthcare in the States, and life down here, and healthcare as it is here.
The thing that led me to nursing was wanting to make a difference and wanting to help those who have the greatest need and the least access. And that really is the functional or key point with this program.
I don't even feel like it's work. It's such a joy to be here.
It sounds like a stupid thing to say, but yeah, it really changed my life completely. Yes.
Well, the program is called a Service Learning Project. It's a partnership between the University of Southern Maine and the Partners for Rural Health in the Dominican Republic.
We do teaching and we do healthcare, primary healthcare, mostly for chronic care management in 22 villages in the north part of the Dominican Republic.
We try to service clientele who have minimal access, who have minimal resources, who without some outside help would not be able to acquire the medications that they need to maintain adequate health or improve their health.
The University of Southern Maine runs the student arm of it, where students take courses and get academic credit for their participation in it. And volunteers are run through the PRHDR arm, and those are community volunteers with medical background or interpreting background, and sometimes a background in management where they might help us do intake.
The most unique part, I think, of this program is that we return every 6 months, and we've been returning every 6 months for nearly 20 years now. And because we do that, we are able to really attend to chronic issues.
I think we've made people's lives better. I think we've empowered them. I think they know how to take better care of themselves and each other. We've certainly learned a lot from them as well.
A mí me han servido tanto, yo quiero servir. Y gracias a esa institución que ustedes nos han ayudado a que podemos servir al que necesita.
To feel both the gift of what they learn, but also the power of what they have to offer. And it's very spiritual in a way.
I think that one of the things the nurses do is have influenced young people here to go and study medicine. We now, in 20 years, have had probably 4 or 5 doctors influenced strictly by the nurses. They have been so influenced by the love and kindness shown to them by these people.
What I've seen most of all is my students, they leave and they're excited and yet they're nervous at the same time, and they come back and they're just so enthusiastic about the profession that they're going into, and so passionate and ready to go back and keep going on trips again and again.
That's why we bring our students to open their hearts and their minds to the fact that they are citizens of the world, that they have something they can give the world, and that they have some responsibility to do that.